Obsessive Compulsive Disorder, OCD, is a chronic mental health condition characterized by persistent, intrusive thoughts, obsessions, and repetitive behaviors or mental acts, compulsions, performed to alleviate the distress caused by these thoughts. Affecting millions of people globally, OCD can significantly disrupt daily life, relationships, and overall well-being. This guide explores the symptoms, causes, diagnosis, treatment options, and coping strategies for OCD, as well as offers insights into ongoing research and societal implications. What is OCD? OCD is more than just a quirk or preference for cleanliness and order. It involves a cycle of obsessions and compulsions that can be debilitating. Obsessions: recurrent, unwanted thoughts, urges, or images. Common obsessions include fear of contamination, concerns about harm, or a need for symmetry. Compulsions: repetitive behaviors or mental acts performed to reduce the anxiety caused by obsessions. Examples include excessive cleaning, checking, counting, or seeking reassurance. OCD often follows a pattern where obsessions lead to heightened anxiety, compelling the individual to engage in compulsions as a way to temporarily relieve the distress. This cycle reinforces the disorder over time. Symptoms of OCD: common obsessions. Fear of germs or contamination. Intrusive thoughts about harm or violence. Disturbing sexual or religious images or thoughts. Perfectionism or excessive concern with orderliness. Fear of losing control and acting on impulses. Common compulsions: hand washing or cleaning excessively. Checking locks, appliances, or personal belongings repeatedly. Counting objects or steps obsessively. Repeating words, phrases, or prayers silently. Arranging items in a specific, rigid order. These symptoms can vary in intensity and may worsen during times of stress or change. Some individuals experience pure OCD, where obsessions dominate without overt compulsive behaviors. Causes and risk factors. The exact cause of OCD is unknown, but research suggests a combination of genetic, neurological, behavioral, cognitive, and environmental factors. Genetics: a family history of OCD may increase the risk. Brain structure and function: abnormalities in certain areas of the brain, such as the orbitofrontal cortex and basal ganglia, may contribute to OCD symptoms. Serotonin dysregulation: dysfunction in serotonin pathways may play a role in the development of OCD. Stress and trauma: stressful life events, abuse, or trauma can trigger or worsen OCD symptoms. Personality traits: perfectionism, excessive responsibility, or heightened sensitivity to uncertainty may predispose individuals to OCD. Diagnosis: diagnosing OCD involves a comprehensive assessment by a mental health professional. The Diagnostic and Statistical Manual of Mental Disorders, DSM-5, criteria include: presence of obsessions, compulsions, or both. The symptoms cause significant distress or impairment in functioning. The symptoms are not attributable to substance use or another medical condition. In addition to interviews, clinicians may use validated tools like the Yale-Brown Obsessive Compulsive Scale, Y-BOX, to assess symptom severity. Treatment options: 1. Cognitive behavioral therapy, CBT. Exposure and response prevention, ERP, a gold standard treatment where individuals are gradually exposed to their fears while refraining from performing compulsions. ERP helps break the cycle of obsessions and compulsions by reducing fear responses over time. 2. Medications. Selective serotonin reuptake inhibitors, SSRIs, may be helpful. 3. Combination therapy. Many individuals benefit from a combination of CBT and medication for long-term symptom management. 4. Advanced treatments. Deep brain stimulation, DBS, For severe, treatment-resistant OCD, involving implantation of electrodes to regulate brain activity. Transcranial magnetic stimulation, TMS, a non-invasive option targeting specific brain areas involved in OCD. 5. Lifestyle modifications. Incorporating regular exercise, healthy sleep habits, and stress reduction techniques can complement formal treatment. Coping strategies for individuals with OCD. Educate yourself. Understanding OCD can reduce stigma and empower you to seek help. Practice mindfulness. Techniques such as meditation can help manage anxiety and intrusive thoughts. Set realistic goals. Break tasks into manageable steps and celebrate small victories. Limit avoidance behaviors. Gradual exposure to feared situations can reduce their impact over time. Use journaling. Documenting triggers and responses can provide insights and track progress. Build a support system. Share your experiences with trusted friends, family, or support groups. Supporting someone with OCD. Be patient and empathetic. Avoid judgment or criticism, as OCD is not a choice. Learn about OCD. Educate yourself to provide informed and compassionate support. Encourage professional help. Support them in seeking therapy or medication if needed. Avoid enabling. Resist participating in their compulsions, as this can reinforce symptoms. Provide reassurance sparingly. While well-intentioned, excessive reassurance can exacerbate OCD patterns. Current research and future directions. Ongoing research is shedding light on OCD's underlying mechanisms and improving treatment options. Neuroimaging studies. Advanced imaging techniques are helping identify brain areas involved in OCD. Genetic research. Understanding genetic predispositions may lead to targeted therapies. Innovative therapies. Virtual reality-based ERP and digital CBT platforms are being developed to enhance accessibility and effectiveness. Biomarker identification. Efforts to discover biological markers could improve early diagnosis and treatment customization. Conclusion. Obsessive compulsive disorder is a manageable condition with the right approach. Early diagnosis, evidence-based treatments, and effective coping strategies can help individuals lead fulfilling lives despite OCD. By fostering understanding, investing in research, and providing support, we can reduce stigma and improve outcomes for those affected by this challenging condition. With perseverance and help, individuals with OCD can regain control over their lives and thrive. Follow for more.